back. This is Dr. Amir Rashidian at Mid-Atlantic Chiropractic Centers. And last time we spoke about back pain. And one of the causes of back pain we talked about was disc pain, discogenic pain, disc causing back pain. We talked about how the difference between a disc bulge, a disc herniation, a protrusion, a sequestration, and how that can hit the nerve, it can hit the spinal cord and cause severe pain, radiating pain, debilitating issues, and all of that. Go watch that video because that's not what we're talking about today. The cause of pain we will talk about today is called sacroiliac joint pain. That's not a bad word. Sacroiliac is the name of this joint right here. So this is the pelvis. This is Charlie. You guys remember Charlie? So the spine comes down. This is the tailbone or the sacrum. And then you've got a bone on this side and on this side. These are called the ilium, ilii in plural. And the joint that the spine makes with the ilium, or the joint between your spine and your pelvis, is called the sacroiliac joint. Why is that significant? Because it used to be believed that the sacroiliac joint doesn't really move. Now we know it does move. We've watched it, we've seen it, we've observed it. It does move. These joints actually move. In fact, your pelvis moves in a figure-8 motion when you walk. So one of the simplest things that can happen is if one side gets locked up and doesn't move properly, what's going to happen to the other side? It's going to have to compensate, which means it'll move more. It'll move too much. So if this side doesn't move, if this side doesn't move, this side, the other side, moves too much. And it can get irritated. Anytime a joint moves too much or moves beyond its normal range of motion over and over, there will be inflammation and irritation. Inflammation will cause pain. Sacroiliac joint pain can be pretty uncomfortable. It'll be sharp. It can radiate down the leg because if it causes the muscles here to tighten and go into spasm, because sometimes either the muscle on the side that's locked up can go into spasm because it's trying to get that bone to move and it's just not moving. So your brain keeps sending signals to the muscle saying, let's see if we can get this to move. So that muscle's working more. Or the other side where the brain and the body know that this is moving too much and the muscle's tightening up to try to reduce that motion so the joint doesn't get so inflamed. Either way, when the muscle's here, mainly the piriformis muscle, you might have heard of this, it's all the way at the bottom in your gluteal region, it can impinge on the sciatic nerve. Sometimes we call that the psychotic nerve. It goes and it'll send pain down your leg. That's your biggest nerve, and it comes out of the spine, and multiple levels form together into one nerve, go all the way down. It controls all the things that happen to your leg. It's your biggest, longest nerve. And so that's one source of pain, is either an irritated sacroiliac joint, a locked sacroiliac joint, muscle imbalance caused by that. Something else can do this too. You've heard of pelvic unleveling maybe? Some people say, I have a long leg on one side. Or you might go to a physical therapist or a chiropractor and they'll say, oh, your pelvis is uneven, meaning when you stand, one side sits higher than the other. Well, if your pelvis is uneven and one side's higher than the other, it's almost like walking on the side of a hill. And that's going to cause muscle imbalance as well. That's something that doesn't cause pain immediately, but over time it can cause a lot of pain and discomfort. And the pain can be sharp, it can be across the whole back, it can be just on one side. Generally, sacroiliac joint pain is on one side. So where the buttocks are, you'll have pain there and close to the spine, but it won't cross over to the other side unless both sacroiliac joints are inflamed and in pain, which is possible. But if the pelvis is uneven, every time you walk, the long leg has to do different things than the short leg. Because as you walk, when the back leg is about to swing through to the front to step, that leg needs to get shorter so it can swing through. If it doesn't get shorter, it'll drag on the ground. Like when you wear flip-flops. By the way, we should do a video on flip-flops. Make a note. We're going to talk about flip-flops on a future video because most of you are thinking, are flip-flops bad for you? And I'll tell you the answer on that video. For now, what happens is that the muscles that tighten, that externally rotate the hip to make the leg short, have to work extra hard on the side of the pelvis that's higher, because that leg's already longer than the other one. So they have to work harder. Those muscles will form trigger points. They'll form knots. Those knots can be very tender and tight. Now, you can go to your massage therapist and have those knots worked out, but unless you level the pelvis, they're going to just come right back. On the other side, usually on the short leg, the inner thigh will have a lot of pain. Muscle knots, tight muscles. The gluteal area on the long leg side will be bad. your IT bands on both sides will be painful. So if you have anything with IT band, adductor pain, inner thigh pain, gluteal pain, pain that's radiating down the leg, and you know you don't have any disc issues, well, it's probably a sacroiliac issue. My recommendation would be see a chiropractor, get some x-rays, get some measurements done, find out if the pelvis is even or uneven, and then have an assessment done to see if the joints are moving properly. The side that's not moving needs to be adjusted so it can move properly. And the adjustment has to be specific based on whether it's the short leg or the long leg, because that makes a difference as well. Once we level your pelvis, we teach the muscles to work properly, you're not going to have any more back pain. So hopefully that's helpful. Take care. Meanwhile, though, if you do have sacroiliac joint pain and you don't want to come see us, put some ice on it, reduce the inflammation. Natural anti-inflammatories are also good to reduce the inflammation, but ideally, you're going to get it fixed. So, anyways, we'll see you later. Have a great day.